perimenopause is a transition from your reproductive life to an end of era of reproductive life. In the perimenopause, because the hormones are still there, but they're fluctuating up and down. So because of that, the symptoms appear. And the most common symptom which happens in the perimenopausal time is the hot flashes. That's like the first thing that, comes into picture, along with the mood changes and then vaginal dryness. And so these are the three most common things which happens, and along with that, change in the bleeding patterns. So the important thing is that estrogen, that is the female hormone, has some effect or the other on every part of a female body. Previously, we used to say that in India, females used to attain menopause at the age of 52, 53, but now there is a dramatic shift, and now they are attaining menopause at a much earlier age, by the age of 48 years or 47 years. And we say that anybody who's attaining menopause around 48 years can experience their menopausal symptoms ranging from 2 years before to even 10 years before. The most important thing is, I think, regular diet and exercise. Nutritious diet, which is rich in anti-inflammatory foods, which is rich in calcium, which is rich in vitamins, which does not include alcohol, smoking, and also at least 4 to 5 days in a week of exercise. You should never think about your weight at all. Weight is just a number. It's not about your weight, it's about your own health. It's important to track your periods, to write how many days after you got your periods and for how many days you got your periods. And if you got your periods, how many hours you are changing your pads. So all these things, they will tell us the intensity of how much of the, how much intensity of symptom you are experiencing. And if you are experiencing mood changes, whether they're present all the time or whether they are related to your periods, so tracking of things is very important, because when you track things, we are coming to the diagnosis then, right then and there itself. The most important thing is that we should talk about menopause and not shy away from it. It is just a physiological phenomena, and the more we talk about it, the more we learn about it, and the more we'll be able to treat the symptoms in a much better way.